do so, but I hope someone else does it who has a deeper knowledge on the statistical side than I. But it needs to be done. I don't have great reference for this. Both statistical modeling and dynamic modeling are evolving, and they have some convergent elements. There are pieces of the Bayesian statistical landscape that I see as getting kind of close to some aspects of dynamic modeling, in the sense they capture mechanistic understanding. So I'm not going to present this as, these are solitudes, these are, there's, east is east, west is west, and never the twain shall meet. I don't believe that's the case. I actually think this is a changing, somewhat fuzzy landscape. So my own perspective on this is that statistical models and dynamic models are fundamentally not in competition, they're not in conflict, both contribute jointly to a successful dynamic modeling project, and it's extremely important to understand where each fits in. What's its kind of natural habitat, its natural range of contribution. Now, the foundational point that I'd like to put at the center of this discussion is one I've been alluding to in bits and pieces. Empirical observations about the world and the data that come from those observations do not come out of, they don't come down from heaven, they don't come out of nowhere. They come from observations on processes. There's some data generating process that statisticians talk about that gives rise to this data, some underlying process that's generating this data. And generally, there's some underlying causal structure to the system, causal pathways that operate on often what are predominantly latent quantities that give rise to it. Latent from a statistical perspective in the sense that there's no observations of them. And these underlying processes are typically dynamic. They evolve over time. They're not purely stationary statistical processes, though in other cases they are. In many cases, they're dynamic. They evolve some state of the system, some latent state is evolving over time, and often those are fairly, under-observed. And statistical models seek to capture aspects of this data generating process in terms of associations captured from the data collected. And dynamic models focus on how the data generating process is evolving or will evolve, for example, in the context of interventions. So statistical models are seeking to capture particularly associations between observables, sometimes positing certain latent structure of the process. How do these observations relate to one another in terms of, for example, trends by which, perhaps in a multivariate regression, one covariate relates to an outcome measure. And observed statistical relationships are, for most of the models I work with, they're associational in character. They're contingent. These observations are contingent on the nature of the underlying process. We will see several models that we will be running where we will see pronounced statistical relationships emerging from the model. We will see a relationship, a gradient, for example, between income on the one hand and some measure of health burden on another. Maybe it's the lower income one is, the higher the number of, the higher the sort of accumulated number of obesity years on average, or the higher the rates of pertussis infection over the life course, or what have you. And these statistical patterns are notable, but they're contingent on the nature of the underlying processes. And one of the things we will find in running these models is that if we run the model with different interventions, we will materially alter the associations observed. Those associations may be pronounced in the baseline case between, say, so I'm going to draw here, say, income. So income is represented in dollars per year, say, and some measure of health burden, and I mentioned a couple of them. And you may see some sort of broad ambient relationship between them like this. But in the context of an intervention, this association will change very materially. In some cases, it may flatten, for example. In some cases, in targeted interventions focusing on lower groups, it may sort of bend down, something along those lines. So the association reflects the underlying process. And when we think about counterfactual situations, that underlying process is being modified. Maybe it's because of a targeted intervention focused on lower income individuals, for example. And moreover, if the system is in disequilibrium, if, for example, the balance of individuals of different ages in the population is changing, or knowledge, attitudes, and beliefs in the population are changing over time, this statistical relationship may be evolving as well. So we will see over time a very different relationship, for example, linking age and TB as one looks historically across multiple decades within our province. So, within statistical models, we will often take note of some association, and perhaps in a projection context, we will identify some trend, and we will try to match it. We will try to do a regression against it, perhaps controlling for a variety of variables. But in this case, time is viewed perhaps as an independent variable, as one of the covariates in the model. But in this case, we may find, having altered the nature of the undergoing process, or in the context of a disequilibrium situation, in the future the system is evolving at a rate, in terms of the speed of rise, which is rather different than it was historically, because of an intervention or because of equilibrium. So the challenge here is that if we're depending on associations, those associations are often contingent upon a certain feature of the data generating process. And if we want to count on those associations going forward, we're counting on the fact that things in the future are similar to those in the past, which is really highly problematic if we're trying to intervene, if we're trying to change things materially, if we're trying to change the nature of the built environment, if we're trying to change the nature of the food environment, if we're trying to change how school-based education campaigns take place, to think about programs like the walking school bus, or programs that will expose individuals to different nutritional environments in the context of school, and engage in education related to that. The risk here is that if we depend on these statistical quantities alone, these associations, well, they may be very helpful for understanding what's going on now, may be very helpful for analyzing pieces of the system. If we rely on them for understanding system behavior, the behavior of the system as a whole, we risk putting our eggs in the basket that things in the future are similar to those in the past, and being disappointed. And the risk here is that we'll be trying to drive into a future where we're going off-road using information purely drawn from the past, associations which were just observed historically. And if the future road is not very much like the past, this is a real problem. If we're going around in a track, what's behind us may be very similar to what's going on in the future. We're in an equilibrium sort of situation, or a stationary process. And what's coming up may be very well indicated by what's been going on in the past. If we're dealing with burden of nosocomial infection in a nursing home, and we are dealing with a very stable situation, year in, year out, just the occasional outbreaks in the winter and so on, what we've seen in the last 5 years may be a pretty good for planning into the future. If, by contrast, we have put into place a radically different cleaning regime or disinfection regime, or we have instituted patient cohorting or staff cohorting, going forward, we may see very different patterns associated with the outbreaks than we did in the past. So if we rely purely on associational relationships, the historic relationships observed between X and Y, even controlling for a set of factors, we may be really rudely disappointed because the data generating process is different. We are now counting on the data generating process to be reliably the same, but it has been shifted out from under us, or we have shifted it out. The contrast here is, in contrast to that, dynamic models seek to capture aspects of the causal structure of the system. Now, this doesn't mean that they're free of any of these problems. As we'll see, we do often incorporate into dynamic models, we incorporate findings, associational findings at the level of small pieces of the system. But the behavior of the system as a whole, the simulated system in a dynamic model, is evolving not according to associations, but by representation of the mechanics of the system, how the system works how it works over time. The physics of the system, the plumbing of the system, whatever we call it, we're actually simulating the number of people with diabetes over time, the number of people who are overweight over time. And if we were to think about, so I'll give you a case. So some years ago, our provincial Ministry of Health came to us, and they said that they were doing planning for dialysis clinics across our province. And they were looking at how the needs for dialysis clinics were changing over time. And they had a statistical model, a model that was based on the associations. They were looking over time at the need for dialysis clinics. And they noticed that dialysis clinic need was going up, fair enough, and they projected it forward here. They projected it forward and anticipated, okay, at year 2010, we'll need so many dialysis clinics in place. Year 2015, another set. Year 2020, another set. Okay, so they were using projections based on the need experienced thus far. They're using these associations in place between time and dialysis clinic capacity, and they realized that this wasn't adding up, because this rate of need for dialysis, I've drawn it very charitably as being flat, but what was actually happening is it was going up something like this. And their thought was, okay, let's deal with that by trying to control for age structure of the population, right? After all, maybe this gradual acceleration here is due to the age structure. So they want to correct for the age structure. So they got population projections for Saskatchewan, for our province, and they plugged them in, and they could account for some of this. But there were parts they couldn't account for entirely. They could sort of project it upwards, but it wasn't capturing the extent of it. And they came to us, and we were talking with them about our modeling. And they said, that's the sort of thing we need to do this, because you're capturing the actual underlying structure of the population in terms of weight, and weight driving things like diabetes risk, which is the cause, and diabetes is responsible as the cause for the plurality of end-stage renal disease cases, and then how that ripples through to end-stage renal disease. That's the mechanics of the system. That's the mechanics in terms of the drivers. Age is part of it, but even if you account for age, the age-specific rates of end-stage renal disease are going up. Why are they going up? Well, part of it is end-stage renal disease cases are going up. Why are they going up? Because diabetes cases are going up. Why are diabetes cases going up? Well, partly because of the growth of waistlines. By taking those things into account, you can do a much, much better job. By taking the mechanics of the system into account, you can do a much better job in matching these rates of growth. And going forward, you're going to have a much more reliable understanding of how the system might evolve than if you're just relying on these aggregate rates, treating time as an independent variable, even correcting for age. So this is a difference between a mechanistic model representing diabetes, weight status, end-stage renal disease on the one hand, versus a statistical association between time on the one hand and dialysis clinic demand on the other. So dynamic models here seek to capture the underlying causal structure, kind of the theory of the system. It captures a sort of theory about how demand in this case is being driven. And the results of this are behavior over time as one component. We'll see behavior over space as well. But here, the behavior over time in the associational model is a function, it's pre-specified, it's a linear model in their system, whereas with dynamic model, it emerges from the process. It emerges as an emergent feature of running the system. It's not plugged in, it results from the interaction of these different features, these entangling in the model of these features that are entangling in the world. So, as in the world, the data observed from a dynamic model arises from underlying processes depicted in the model. The data that comes out of that model related to GIS, about the association on the one hand between distance to a park and weight, that's resulting from observations on some complex underlying processes that involve food-seeking behavior, use of parks, that involve people's weight being affected by those by the nature of the dietary intake and physical activity. So within dynamic models, we're seeking to capture the causal structure of the system at some abstract level, and because we're trying to capture that causal structure, it's designed to examine counterfactuals. It's designed to ask what-if questions about situations that have not been seen, situations in the future, or policy regimes, or aspects of the external environment, such as economic trends, changes in oil price, or what have you. And one very important class of these counterfactual situations are the ones focused on interventions, and I think that's of particular interest to those of us in the room. So dynamic models, when compared to a regression with time as an independent variable, they're quite different. The mechanistic model depicts the theory, underlying theory of the process, whereas a regression with time as the independent variable imposes a functional form, looks for the associations in historic data. If you are going into a regime where the past is not necessarily indicative of the future, they'll give very different results. And again, the behavior of the dynamic model emerges from the model rather than being pre-specified in. People sometimes ask about Markov models and how do Markov models relate to simulation techniques. Markov models, as captured in triage or other techniques, and have been applied by Milt Weinstein and the whole Harvard School of Public Health, Harvard Center for Risk Analysis group, and many, many others. They're designed to capture some elements of what dynamic modeling can capture. It has some initial state, some step-by-step updating, some incremental specification of change based on the state, based on probabilities of transitions. An important difference is Markov models are traditionally linear. The probability of transitioning is often treated as fixed or exogenous. It's not depending on the number of individuals in other states. And the Markov model is often characterizing a closed cohort. It's a fixed cohort going forward. These models have great difficulty scaling to capture heterogeneity, as we'll see system dynamics modeling, when used at an aggregate level, also has similar problems scaling to capture heterogeneity. By contrast, agent-based modeling captures it exquisitely well. They have particularly difficulty, Markov models, in capturing continuous heterogeneity. If you want to capture the effect of birth weight or your current weight, you have to discretize it into often quite coarse categories. And within a Markov model, it's difficult to capture the effects of networks, effect of space, spatial context, geographic context. Difficult to reason anything about the longitudinal trajectories of an individual over time. Or to capture aspects of nested environments. Think school, neighborhood, or city region, the city as a whole, etc. So Markov models do provide some flavor, and they are variously classed as a system science technique or not, depending on the classification that you use. If they're a system science technique, they're often used in a very simple way that is subject to linear assumptions that can be solved actually in closed form, and that it lacks a lot of the key emergent features that you'll see in the other three techniques. Now, statistical models are used for diverse purposes: hypothesis testing, identifying statistical relationships, sampling for distributions, estimating, prediction, and forecasting, like that case over there. Dynamic models differ perhaps most fundamentally from statistical models in how they're used. Dynamic models look forward, particularly reasoning about never previously observed counterfactuals. They are designed to look at these cases where the data generating process is different. Whereas statistical models, almost by definition, they're looking at data that was generated in the past, and as such, they tend to be somewhat backward looking. Some people asked a little bit about path analysis. Path analysis is a great little technique. We make use of Bayesian conditional models, which have some similarity, and it's a powerful technique for reasoning about conditional probabilistic structure of a system. It does have some very strong assumptions associated with it, but I should first emphasize path analysis is a technique fundamentally for performing a statistical analysis. It's not designed to sort of anticipate the evolution of a system in counterfactual situations. Is not typically how it's used. But it also carries some strong assumptions. Each variable has an associated observation. There's no latent variable associated, in contrast to SEM, for example, structural equation modeling, where there is. There's an absence of reciprocal causality. A big goal for system science techniques is to capture reciprocal causality. Again, we build buildings shape us. We build our social networks shape us. Our weight affects our physical activity, and vice versa. Our physical activity affects our diet, and vice versa, etc. And moreover, there's structural equation modeling assumptions of linearity and Gaussian error terms that can be really problematic for certain cases. And I would particularly highlight linearity as being very different from what we see in system science methods, where capturing nonlinear features is quite central, and where the error terms are often most certainly not Gaussian. Path analysis also has difficulty capturing nested context and reciprocal causality, and it also has problems dealing if the structure is evolving over time, the structure of the system over time. An area where I think statistical modeling is getting closer to dynamic modeling is what are sometimes called causal statistical models. These are models that seek to incorporate hypothesized causal structure. And indeed, some of these models, mechanisms of the system, sort of reasoning about the latent state of the system is actually incorporated. And I see these as getting much closer to dynamic modeling. And I see no reason to draw firm boundaries. I think there's going to be a meeting of the minds here as there's a collision between statistics and many other disciplines in a very positive direction. Traditionally, causal statistical models typically incorporate comparatively few latent variables just because of the integration that may be involved, or the size of the space that has to be explored by the MCMC process. These models are getting closer in terms of their capacity to examine counterfactuals. And I think there's going to be a future evolution where the two might converge significantly. I will tell you, and I'd be glad to give a lecture on this, I spend much of my time these days combining dynamic models with statistical approaches in the form of MCMC, Markov chain Monte Carlo techniques, and sequential Monte Carlo or particle filtering. I believe these techniques work extraordinarily well with dynamic models. I've just published a book chapter in a book I co-edited, which has just come out, on Handbook of Analytic Methods for Dynamic Modeling, which deals with Markov chain Monte Carlo. And we have a number of papers related to applications of sequential Monte Carlo techniques to dynamic methods, particularly in the context of incoming data, where you want to deal with a model that may be quite rough and ready, and you're constantly regrounding it and using it to look forward, but you're recognizing that the model itself is often needs to be corrected in its interpretation of what's going on, and it needs to learn from the data as it comes in. So particle filtering is a great way to learn from incoming data, putting it at a rough level. Okay, those are the comments. I apologize for their crudeness. Any questions about this, and then we can break for lunch? Yes?
One feature of statistical models is you don't just get a projection, you get a prediction interval.
Correct.
Do you have something similar
Yes,
to dynamic models?
Yes, we do. In fact, thank you very much. Your name?
Chris.
Chris. So Chris, thank you very much. With dynamic models, a key element of dynamic modeling is to be able to articulate findings from the model taking into account the fact that often these simulation models exhibit significant stochastic variability. So if you run that model, in fact, many of the models we looked at this morning, if you would run it many times, you would have noticed different results. You actually need to go in the experiment and set it to use different random number seed, which is, for some you may have to do that. But in any case, you'll see different results. And if we're going to give policy recommendations, or we're going to comment about whether one intervention yields more favorable results than another, we need to be able to reason robustly in the context of this statistical variability. And so what we typically do is we'll run what's called an ensemble of these models. So we'll run not just one realization, but many. And we will accumulate data from those and summarize it. And we will often use non-parametric statistics, Kolmogorov-Smirnov test, or Mann-Whitney 1-U test. Sometimes you'll use some other non-parametric techniques to sort of compare one technique to the other. And in the process of that, you pick up bands or intervals on outcomes that capture broad regularities, but exhibit stochastic variability or variability within the scope of those bands. So they capture regularity, but there's variability within that regularity. And I'll be showing you as one of the exercises how we do this with these models in the course of the week. Okay? And if the people are interested, I can also refer you to some online lectures about it. Yeah.
And that captures the stochastic nature of the model.
Right.
Does it also capture, presumably
Yes.
your parameters for governing transitions are also estimates?
Correct.
Does it capture the variability in them?
Yes, we use it in the same way for that. So in other words, you could put into your model, in fact, there's a built-in AnyLogic. The software supports a built-in experiment type called parameter variation. And you can use that to put in place either what are sometimes called in the microsimulation community parameter sweeps of the model, where you systematically examine the impact of different parameter assumptions in a regular gridded way. Or you could put in place Monte Carlo draws from distributions. So a given parameter will be drawn from a distribution, say a normal distribution with a certain mean and a certain sigma, and you'll run the model many times with that and see what the implications of that are for model variability. So it's the same basic approach with parameter variation can be used for that. And it's actually very, very straightforward to do, and we'll see some examples. Okay. Yes?
My name's Colin.
Thank you.
Do you think, do you see recursive partitioning? Have you come across that? Is that a step from stats models towards dynamic?
Oh, that's an interesting question. I've heard of that over time, but I have to confess, I need to, it's been a while since I heard about it, and I need to read up to be able to comment firmly. Can I comment on that tomorrow?
Sure.
And I'd be happy to do that. It came up in a conversation some time ago, as I recall, but I just don't remember the texture of it enough to give a genuine answer to it.
It seems to unleash some of the assumptions that the regression models make
Okay.
about the way outcomes and predictions are related. It just came to mind when you were talking about that intersection.
Right. Yeah. Nice. Thank you for highlighting. And I in case you can't tell, I mean this interface between statistical and dynamic models is actually quite central to some elements of my research program, particularly because I work at the confluence of big data, where I'm using a lot of not only dynamic models, which are a key part, but also machine learning models. And I'm using them together with dynamic models in many cases. And so this intersection is very much of interest to me. So that sounds like something I'd like to pursue, and see if I can get you some comments. We will later and as a result of some of the examples, we look at some cases like where we can use dynamic models together with statistical models to help refine statistical models, where we use the dynamic model as a data generating process, actually use the model to generate data and use it to test different statistical measures or metrics for reliability, use it to improve inference, use it to basically evaluate analytic lenses which we might deploy in a real population and identify blind spots in those and try to work towards more robust ways of measuring certain relationships. It's a very good use, particularly of agent-based models. So let's see if we can talk about that. Any other questions? Okay, ladies and gentlemen, lunch I think is served. So it's there in the back, and I'd like to encourage further mixing. Oh, one other thing. We're going to be diving this afternoon in a big way into hands-on work. I was so happy to see people mixing in the back before. I think it's a really important point to get to know each other. During this afternoon, I'd like you to think about trying to help each other out as well. Because often, one person gets stuck, and if they can look over at the next computer over or get a bit of a pointer, it can take the load off our two TAs here in a big way. Just, they're going to be needed heavily at times, but if you can help each other out a bit, it's great for your learning, and it's great to help it go along smoothly. So think about that. Dylan.
And incidentally, if you don't have the software installed on your computer yet, if you could let me or anyone
Yeah, they'll install that. Okay? So